Hey everyone, Adam Sutphin here, Doctor of Physical Therapy, and today I'm going to show you why your back hurts when sitting. So the diagram you see below here is the um, diagram of the lower part of the back, and what we have here are the bones that make up the spine of the lower back, as well as the ligaments. So the white parts here on the front, on the back, and the sides are what are called your ligaments. So that's the front side. That's kind of your side view. And then we have the back view. So we're going to focus here first kind of on the back because this is the area that you can feel and the area that most typically, you'll develop that actual pain in the back. So what these ligaments do is they actually hold the bones together of the spine. So they provide stability to the spine and kind of help keep everything where it needs to be. So what can happen over time is these ligaments, they're made up of an elastic material, so they can actually become stretched. So just like a rubber band, when these ligaments are repeatedly stretched time and time again, they actually begin to lose some of their elastic properties. I'm sure you can imagine where if you've taken a rubber band and you stretched it over and over and over, eventually that rubber band is going to snap. Um, so, when you think about when you sit all day for prolonged periods, there's a great deal of stretch being placed on these ligaments, and eventually they're stretched to a point where they lose some of that elastic component. When that happens, the back is now more unstable, and that's where a lot of times you'll develop this localized pain in the lower back in this area where the muscles are now being overworked essentially. Now, if the ligaments are overstretched to even a greater point, now what will happen is these structures in between the bones, right here, the disc, can start to become irritated. So we'll take a closer look here. The disc can actually move in between those bones. It can move forward, sideways, backwards, etc. So when the ligaments get stretched to that degree, those discs now start to move more than they should. So we'll take a look over here at a little bit closer view. And you can see here, this is a normal disc, and you can see how it moves forward and backwards as the spine moves forward and backwards. However, what happens is eventually if you move, the disc gets unstable, it'll now start to pinch on that nerve. And that nerve will start to give you that shooting pain down the leg. So hopefully that makes sense. Hopefully you find that helpful. If you have any questions, feel free to reach out to me. That's it for today, guys.